I'm VJ Hamilton and welcome to the Autoimmune RESET, the place for you to learn how to thrive with autoimmune disease and feel empowered to take steps to transform your health to feel better than ever. You can start making changes today to improve your health. So with every episode, my mission is to share with you simple ways to up-level your diet and lifestyle with key learnings from my own journey reversing autoimmune disease and inspirational stories from those who have reset their autoimmune symptoms and are now thriving in life. I suffered from autoimmune disease for over 25 years and now I live symptom-free, and I wish the same for you as well. So thank you for being here and sharing this time with me. Now let's get started. Hello and welcome to today's episode of the Autoimmune RESET podcast. I'm your host, VJ Hamilton. I'm a nutritionist, scientist and expert in autoimmune disease, and I'm excited to be back with you today. I was away last week at a functional medicine conference in Las Vegas, so I had a lot going on and I am glad to be back here and sharing more information with you on this podcast. I have lots to share with you from the conference as well. I've probably got enough content to share with you for the next couple of months, so I'm excited for that. But today we are doing a deep dive episode into scleroderma because it is Scleroderma Awareness Week and it is a fairly complex and fairly rare autoimmune disease, but I do see it in my clinic quite often. Actually, I am working with clients with different types of scleroderma and we work on different parts of their health depending on what the underlying root causes of their condition. And we will talk about that in a moment because not everyone with scleroderma has scleroderma for the same reasons. There can be many components to it, and that's what we will talk about today. So let's go through what scleroderma is, because scleroderma, the word comes from the Greek word sclero, which means hard, and derma, which means skin. And one of the manifestations of the condition is hardening of the skin. And the reason that this happens in scleroderma is because there is an increase in collagen production, and collagen then deposits in the skin and creates that hardening. Now, I'm sure you've come across collagen before. We're usually talking about it in a very positive light because it is extremely important for skin health, for gut health, and it has some key amino acids in it when we are taking collagen. But we don't want our body to massively overproduce collagen, and that's what happens in scleroderma. Collagen is a fibrous type of protein that makes up your body's connective tissue, and that's why it's very important for other conditions. But in scleroderma, there is this effect that the body goes into overproducing collagen. And a lot of people will ask me when they have scleroderma, should they be taking collagen if their body has that susceptibility to be making more collagen? And the truth is, when you take collagen, it does get broken down to its building blocks, so broken down into those amino acids. So it doesn't mean because you are having more of collagen that you're going to produce more, because your body has that ability to produce it itself from, even the foods that you're eating. It's very debatable, that discussion, but there is no evidence to suggest that taking collagen can lead to scleroderma or worsen scleroderma symptoms. But who knows where the research will go on that. But I have looked into this previously, and I think actually when clients have issues with their guts, and other issues going on, then collagen can be helpful. But everybody is an individual and you need to work with what's going to be best for you, because collagen obviously isn't right for everyone. But scleroderma, as I mentioned, results in this overproduction of collagen in the body tissue, and that's why you get this thickening and hardening of the skin. I remember when I was probably at my worst in my health, and I hate to always talk about what I've been through, but I just want to share it with you because I just feel like I've been kind of touched so many of these different conditions, and that is the truth. If you have one autoimmune disease, you are more likely to develop other autoimmune diseases. But I did have a slight area on my leg, which is actually still there, which just came out of nowhere and was some hardening of the skin, and it looks almost like scar tissue. Now, I went to the doctors and they didn't really think much of it, and I have never seen anybody since then, and that was, I believe, over 10 years ago now. So they weren't too concerned about it. But now looking back, I can see that it looks very much like scleroderma. But I've never been diagnosed with that. But that's what it can feel like. So just something that comes out of nowhere almost, this hardening of the skin. But on top of that, it can also cause your skin to lose its elasticity. And when that happens, the skin can become shiny and it stretches across the underlying bone. So that's something to look out for as well. Ordinarily, it will begin in dry patches on the skin, on the hands or the face. And that skin begins to get thicker and harder. And that's what happened in the little patch that I had on my leg. I just thought it was a spot at first, to be honest, and then it just got harder and harder, and it's still there to this day. But there are two types of scleroderma. One is localized and one is systemic. So localized ordinarily affects the skin and sometimes the muscles and bones underneath the skin, while systemic scleroderma affects the skin, blood vessels, and internal organs. So it is systemic in nature. We know in autoimmune disease there are those two categories. One that is very localized and might affect a specific organ. And then we have other autoimmune diseases like vasculitis and lupus, which affect our body systemically. So there are two types when it comes to scleroderma, one localized and one systemic. And there are different autoantibodies that are tested, and that can clarify which type of scleroderma that you have. It's not a diagnostic. When you are tested for autoimmune disease, in any autoimmune disease, and they're looking for autoantibodies, that is not the specific diagnosis. They look into your clinical features as well. So just bear that in mind. Just because you have the autoantibodies doesn't mean specifically that you're going to get diagnosed with that condition. But I would be very wary if you have been tested for autoantibodies and they have shown up, because as you may know if you've listened to my previous episodes, that when you have an autoantibody for a condition, that's almost stage 1 of autoimmune disease, and that can go on to develop to stage 2 and stage 3 when you start to get symptoms. So if you do have any antibodies, because I have a lot of clients coming to me with thyroid antibodies and their doctors have decided to just wait and see, I would certainly be doing something about that if you do have any of those antibodies present. There is a specific subtype of systemic sclerosis, which is a form of scleroderma, because it goes into even more categories, and it can get quite confusing actually. So there is systemic scleroderma, which has both cutaneous, limited cutaneous, and diffuse cutaneous scleroderma. Now we'll talk about the differences between those two in a moment, but there is a specific type of limited cutaneous scleroderma called CREST syndrome, and stands for a combination of 5 specific symptoms commonly seen in this condition, and it can really help with the diagnosis. So let's go through what the CREST syndrome, so CREST, stands for. So the C is calcinosis, and this involves the formation of calcium deposits under the skin. You may be able to see them and in the tissue, which can be painful, and it can actually lead to skin ulcerations. So that's something to watch out for. And these deposits are often found in the fingers, hands, and other pressure points. The R in CREST is for Raynaud's phenomenon, and I have spoken about Raynaud's before. I work with lots of clients who have Raynaud's, whether they have it as a part of having scleroderma or they have Raynaud's with no known cause, and it may be due to something going on with their circulation. But Raynaud's is the R in this CREST syndrome. As you may be aware, Raynaud's is a condition where the small blood vessels in the fingers and toes constrict, and that ordinarily will happen in response to cold or stress, and that can cause the fingers to go white or blue and feel numb and cold. And this is often one of the earliest signs of this type of scleroderma. So if it starts happening to you out of the blue, you haven't experienced it before, then it might be worth going to see your doctor about it, just to make sure that it isn't anything like scleroderma. And it's always worth to get checked up if you have any new symptom. The E is for esophageal dysmotility, and we'd probably have that as an E in the UK. But this refers to problems in the movement of food through the esophagus due to weakened or scarred esophageal muscles, which can happen in scleroderma because your esophagus is obviously connective tissue as well, so you can have damage there. So if you're noticing any new reflux or any issue with that particular system, then it might be an indication of having scleroderma. And this can cause symptoms such as difficulty swallowing, heartburn, and gastroesophageal reflux disease, which is often referred to as GERD. And there are various ways that I work with clients to help them when they are experiencing GERD, because it's not always about working on the autoimmune responses. I help my clients with their symptoms and what they're experiencing based on some of the damage that some of these autoimmune conditions can cause. Sometimes, luckily, there might have some symptoms that are reversible, but there might be something that has happened in the body, especially if there has been some damage that we just need to work with. And I like to always remain hopeful, but with these types of conditions, when there has been damage to the esophagus, it is quite hard to correct that just with natural therapies alone, although there are things that you can do to help manage it. Then we have the S, which is sclerodactyly, and this involves this thickening and tightening of the skin on the fingers and hands, and this can get to the point where it's actually quite hard to bend your fingers. So that again is something to look out for, and that can lead to reduced mobility and cause the fingers to curl inwards and make it difficult to just doing day-to-day tasks, because we need to use our hands to pick things up and to type and to write and to just even open a door. So that is again something to look out for. And last but not least, T is for telangiectasia. And what that means is when there are these small, widened blood vessels which are visible under the skin, and they can appear as red or purple spots. And they are most commonly found on the face, hands, or mucous membrane. So have a think about some of those symptoms. And if you have been experiencing them, then certainly go and get that checked out with your doctor, because the first step really, if you are experiencing symptoms, is to speak to your doctor and look into getting diagnosed. You can also be working with a nutritionist like me or other health practitioner to help you with your symptoms and help you with how you're feeling. But diagnosis is absolutely key to this. I also run Cyrex testing and antibody testing in my clinic, but you can work with your doctor to get to the point to understand what your symptoms are. And there are, as I said, there are various different types of scleroderma, so it's worth understanding which type you've got. Now, I mentioned that there is both limited cutaneous and diffuse cutaneous scleroderma. So what is the difference? Because we know CREST, those symptoms that I just explained, relate to limited cutaneous scleroderma, and CREST syndrome typically affects the skin on the face, hands and arms, and sometimes on the lower legs and feet, which is different to the diffuse cutaneous systemic sclerosis, which involves more widespread skin changes. And there is a higher risk with this type of scleroderma of internal organ involvement, and that's when the condition becomes a lot more serious and when you really will need the help of your doctor. I mean, you will need that with any form of autoimmune disease and scleroderma. But yeah, you need to get that checked out because it's important that you have medical intervention as well as anything else that you might be doing for your health. So with CREST syndrome, patients often have a more stable and slower disease progression compared with the diffuse systemic sclerosis. So it's just to be mindful of that. And as I said, there can be complications with the diffuse systemic sclerosis with the internal organs, and it can affect both the digestive system and vascular health, which is why it's really important to get on top of it. When you are looking to be diagnosed with any form of scleroderma, they'll be looking at the clinical evaluation, going through these symptoms that I just mentioned. They'll look at your medical history, and they are going to be testing for a lot of different autoantibodies, because there are various different antibodies that can be at play with different forms of scleroderma, which is quite useful actually to be able to test different autoantibodies and to understand what particular type of scleroderma you might have, because that might change the approach in your treatment and also my approach in natural therapies as well when I'm working with clients. So let's quickly touch on the key features of diffuse cutaneous systemic sclerosis so you understand the difference. So when it comes to the diffuse cutaneous systemic sclerosis, there will be a thickening and hardening of the skin in more areas. So you'll see it in larger areas of the body, including the abdomen, the upper arms, the thighs, and the hands. And there is likely to be more severe skin changes, which are more extensive and severe than those that we see in the limited cutaneous scleroderma. And that can lead to significant tightness and restriction in mobility, and it can happen quite quickly. So there is often, with the diffuse cutaneous, a more rapid onset of symptoms, and there is, as I mentioned, more risk of internal organ involvement, and it can affect the lungs, heart, kidneys, and gastrointestinal tract. So it's just worth getting ahead of it if you notice any changes in your skin, because there can be that involvement of the internal organs as well, and that's when we need to really make sure that we are doing anything that we can to stop the inflammation, to stop the autoimmune response, so that we prevent damage to those organs and our skin as well, which is important. So what causes scleroderma? I think this is the question that we have for many autoimmune disease, and unfortunately, as with a lot of the autoimmune diseases, the exact cause is still very much unknown and it is being researched, but based on the most current research, it's believed to involve genetics, and if you have scleroderma, you are likely to have a genetic susceptibility to scleroderma, but also those environmental factors. And I think scleroderma, out of all of the autoimmune conditions, well, out of many of the autoimmune conditions, one of the driving factors seems to be chemical toxicity. And if you have any chemicals in your home or in your work environment, then it may mean that you're more at risk of developing scleroderma. That's what a lot of the research is looking into, how chemicals can trigger autoimmune disease. And one of the tests that I offer in my clinic, which is again one of the Cyrex panels, will look at the way that chemicals can attach to our cells, almost disrupt the cell and cause an autoimmune response to those cells based on the chemicals that we interact with. Sometimes you will just have more of a susceptibility to these chemicals. It could be the case that your detox pathways are overburdened and you're not able to detox those chemicals, and they can have more of an effect, and it can just be to do with the long-term exposure as well. So if you have been diagnosed with scleroderma, I would say one of the first places to look is chemical toxicity, because that seems to be more of the link than other things. For example, in other autoimmune diseases like multiple sclerosis, we know that Epstein-Barr virus might play a role, whereas most of the research behind scleroderma is looking into these both industrial and pharmaceutical chemicals. Outside of CREST, I have kind of talked already about some of the symptoms, but it is just worth checking in with those symptoms that you might experience if you have scleroderma. So one of them can be numbness, pain, colour changes in your fingers, toes, cheeks, nose and ears, which can often be brought on, as I said, by cold or emotional distress. And ordinarily that will be Raynaud's phenomenon, but it can be other things as well. So just look into whether you're experiencing any changes in those areas. You may have stiffness or pain in your joints or curling in your fingers. You may have issues with your digestion, and that can range from poor absorption of nutrients to delayed movement in food. So you might have a long colon transit time, and one of the things that I ask my clients to do is to check their colon transit time, and that's because if there's any scarring or any damage in the guts, then it may mean that you're not able to absorb as many nutrients in your gut, but also it may mean that the motility of the gut, which is governed by this thing called peristalsis, is not able to move the food down as quickly. So if you have a long colon transit time, then something like scleroderma might be at play. I mean, not for everyone, but it's just worth bearing these symptoms in mind with your other symptoms. You may also have sores over your joints, especially your elbows and your knuckles, and having puffy hands and feet, particularly in the morning, could be a sign of scleroderma. Diagnosing scleroderma can be challenging because these symptoms often overlap with lots of other conditions. If you don't have scleroderma and you're listening to this, I'm sure like me, you start thinking, I did have a symptom like that, and maybe that's why that happened in the past. And to be honest, I even started this episode talking about the hardening of the skin that I've got. I have no idea why that's scleroderma. But when you listen to these symptoms, they could relate to lots of different things, and that's why testing for those antibodies, having a physical exam with your doctor can be really helpful so that you get to the bottom of what your symptoms relate to, and then you can move forward with treatment and looking into doing things with natural therapies as well. As well as chemicals, researchers have identified a tiny bacteria which is known as a nanobacteria, and this again is tested on one of the Cyrex panels, the pathogen associated reactivity screen, and that may play a role in the formation of calcification found in scleroderma and other disorders. So cells actually get infected by this bacteria and they develop deposits of minerals on their wall, and that can lead to these symptoms of scleroderma. So it is worth ruling out whether any pathogens might be causing your scleroderma, because the first step in any autoimmune disease is to eradicate the trigger as much as you possibly can, because whilst that trigger is there, that autoimmune response is likely to continue. So that is kind of the first place that I will start with any client. I do a full health assessment. I go through their health history, go through their current symptoms, go through all the research in relation to their condition and the symptoms that they've, brought to me, and understand what is triggering this for them. Because once we remove that, it's much easier to start to recover and start to heal. And that's, my first point of call, because the other pathogen that is associated with scleroderma is the parvovirus, and there has been a study that showed that there is a higher prevalence of antibodies to this virus in patients with systemic sclerosis. And there is actually another study showing that parvovirus can trigger celiac disease as well. So I think with these autoimmune diseases, we often think that it's our body targeting our own tissue and it's just a genetic thing and we can't do anything about it. But the truth is, there's often either a pathogen or a chemical or something else at play that is causing it. So you can take control of that. And I'm not going to say it's always easy to get rid of these things, that especially if we're exposed to it on a daily basis or at work or in our atmosphere. And actually, if we do have infections, they aren't that easy to clear. But at least we know what we're working with and we can take steps to address that. When it comes to foods and other things that might trigger issues for somebody who has scleroderma, then you need to go back to the fact that this can affect their esophagus and it can cause GERD. So anything that is going to overstimulate the production of stomach acid or may aggravate heartburn needs to be avoided, and those are things like caffeine and chocolate and even ginger, as well as spicy foods. And then foods that are either very hot or very cold should be avoided as well. So when a client comes to me who has scleroderma and I'm taking a functional approach to help them, I will be ruling out lots of different things, including toxins and allergens and infections, and going through their story and understanding the things that have affected them in their health and their life and what might be contributing to these symptoms. Because as with any autoimmune disease, scleroderma is likely triggered by inflammation in the body. You will have this genetic susceptibility and autoantibodies, but it's when you're in that inflamed state that you're more likely to develop symptoms. So as well as everything else we've just discussed, I'm also going to be looking into somebody's gut health, because we know that when the gut is out of balance, or if there's fungus or yeast in the gut, then that can create leaky gut syndrome, and that can lead to inflammation as well. So these are things that I will be certainly ruling out. Now, there are lots of different natural therapies when it comes to scleroderma. I'm not going to be able to talk about them all today, unfortunately, but there is a great paper, an alternative medicine review by Dr. Alan Gabby, and I'm just going to touch on a few areas that are in that paper, and it really goes through all the research into the natural therapies for scleroderma. So these are some of the things that I'm going to bear in mind when I am working with clients to make sure that we are on top of everything when it comes to diet and nutrition for scleroderma. As with any supplement or any nutrient, it is always worth working with a nutritionist, because there are certain dosages that are going to be important when it comes to them becoming therapeutic. So you need to understand what the right dose is. But on top of that, you need to rule out whether any of these nutrients or supplements might be contraindicated to, one, your condition, and two, any other medications that you're on. So I'm going to discuss some nutrients that may help with scleroderma, but I would recommend you working with a nutritional therapist if you want to start implementing these into your daily routine, just to make sure that they are right for you, and they each have different effects in the body. So one of the nutrients that has been studied is para-aminobenzoic acid, which is also referred to as PABA, and that has anti-fibrotic properties. So that means it is helping with the symptoms that scleroderma causes, because it causes this hardening of the skin. So PABA can help to loosen that. So that might be something to look into. There has been quite a lot of research and studies into PABA, but there is a certain amount that you really need to have a result, and I wouldn't say this is for everybody. Again, as I said, it is quite a unique product, and you need to just make sure that it's not contraindicated with anything else you're taking, because there are also, side effects with these types of nutrients as well, and a fever or rash can occur with this nutrient, so you just need to be careful. PABA has been shown to be effective and an antifibrotic in scleroderma. The other vitamin that has shown to have anti-fibrotic properties, but also acts as an antioxidant, and we know that oxidative stress and inflammation is part of this condition, is vitamin E, which you can take both orally, but you can also use it as a topical application. And that's something that's quite nice to do. So if you do have any scarring tissue, then it's just to put some vitamin E solution on top of that, and that may help to loosen the skin as well. Another vitamin which is extremely important in lots of different autoimmune conditions, and in particular scleroderma, is vitamin D. It helps to regulate the immune system, and we know that part of most autoimmune diseases, probably all of autoimmune diseases, is the immune system has lost tolerance and it's starting to attack self-tissue when it shouldn't. And vitamin D can really help with that. It is it's spring and summertime in the UK at the moment. This is the best time to go out and get enough vitamin D from the sunlight. You don't need to go out for a long period of time, but expose more of your skin to the sun for a short period of time, and you're going to create more vitamin D from the sun exposure to your skin. Vitamin D has also been shown in the studies to inhibit the growth of fibroblasts, which create that collagen synthesis. So it has both that immune regulatory property, but it also helps to stop the autoimmune response that is happening in relation to scleroderma. So that's a great one to either increase through exposure to the sun or look into supplementation. But best thing to do before taking any vitamin D is to check your levels, because when you take too much, it can become toxic and it can lead to things like kidney stones. So certainly check your levels first, and there's some great tests that you can do online for that. The next nutrient is GLA, which is found in evening primrose oil. So GLA is for gamma-linolenic acid. You can find it in borage, evening primrose oil, blackcurrant. And what this does is it converts to this prostaglandin E1, and that increases the capillary flow and decreases inflammation. So this nutrient in particular is really important if you have Raynaud's phenomenon and might be something to work into. So these are kind of the top 4, I would say, that have been researched, and they know why it helps with scleroderma. However, there are a few other nutrients that they've shown to be beneficial for scleroderma, but the mechanism still isn't fully understood. That includes estriol. They find that women who have scleroderma, that during pregnancy their symptoms improve, and estrogen may have a protective effect when it comes to scleroderma. There is also N-acetylcysteine, which is known as NAC, that has also been shown to help to decrease symptoms of scleroderma. There's S-adenosylmethionine, which is normally referred to as SAMI, that has been shown to be effective in scleroderma. There's bromelain, which is a component of pineapple actually, but that has been shown to help with scleroderma symptoms, and even avocado and soybean extract. So there are a few of the things to potentially look into yourself. And on top of that, they found that those with scleroderma were more likely to have a zinc copper deficiency. So by correcting that deficiency, they found that those with scleroderma, their symptoms improved. So again, it's worth checking in your mineral levels and just making sure that they are optimal. There are various ways that you can do that. I offer testing through my clinic called the Metabolomics Panel, and that looks into some key minerals. That one doesn't look into copper, but it does look into zinc. And then you can do some elemental analysis. That's another panel that I run. It will look at all the key minerals in the body and just making sure that they're in balance. And you can also add on to that a heavy metals panel, because when you have exposure to heavy metals, it can throw out the balance of minerals, and potentially that is a factor in scleroderma as well, because we know there is this chemical toxicity piece, or there may be anyway. That's what the research is indicating, although we don't know for definite that that is what is causing it. But it may be related to the effect that it has on displacing some key minerals in our body. And lastly, I just wanted to talk about the connection between silicon compounds and different autoimmune reactions in the body. And there has been a case report that has shown a possible causal association between silicon breast implants and systemic sclerosis, but there is more research to be done in that area. And as I said, there isn't conclusive evidence for that. Always remember that these conditions are complex. It is never one thing. There is the genetic susceptibility piece, and on top of that, there are probably numerous environmental factors that contribute to you developing these types of conditions. And that may sound quite overwhelming, but it's probably like 1 to 2 to 3 things that you need to concentrate on and to address, because they're probably making up the majority of the issue. And once you work on those and you start to feel better, then you can start optimizing different areas in your life and keep on improving. But when you address kind of the 3 main components that are affecting you and causing your condition, you may find that you then are able to optimize your life and your health even more by making smaller changes to your health. And when it comes to lifestyle, there are many factors which can help with scleroderma for various different reasons, and these are lifestyle practices that can help with many autoimmune diseases. But hydrotherapy and having warm baths or hydrotherapy can help to improve circulation, and we know that can be impacted with scleroderma, and it can also reduce the stiffness that you feel in those affected areas. And you may find relief by having a long soak in an Epsom salt baths as well. And if you're not aware, an Epsom salt bath can really help with detoxification too. So if chemical toxicity is part of your condition, then that can certainly help to decrease the amount of toxicity in your body as well. And it's not as easy to do that, is it, during the summertime, but I do still try to have Epsom salt baths at least a couple of times a week just to get the benefit of that detoxification. And there are other ways that you can detoxify too, like saunas or infrared saunas. They are a great way to do it. And just any type of sweating that you will be doing can help to release toxins too. And obviously working on your stress is always going to put your body in the best state to recover. Ensuring that you are doing your best to optimize your sleep. It's not always that easy, especially if you have sleep issues, but sleep is where we recover and restore. So try and get as much rest as you can and work on various ways to improve your sleep. If you not currently tracking your sleep, then I think that is a great tool to find out what is working for you, because I can list you 5 or 10 different ways that you can improve your sleep, and I have done previous episodes on that. But you need to find what's right for you. And I found when I got my Oura ring and I started learning about, okay, when I eat at this time, I'm not getting as much deep sleep. When I exercise at this time, it's affecting, how long I sleep. And I, over the years, have come up with a regime that works for me. And as with anything, when it comes to diet and lifestyle, it needs to be personalized to you and it needs to work for you. So I'm talking about one specific condition today, but the truth is, everybody that's listening to this who has scleroderma, there's going to be a different recovery route for you, and it's got to be right for you. As much as a lot of this stuff can be helpful to many people, you need to find what's going to be right for you to get better. And lastly, making sure that you exercise regularly can help with joint mobility, your muscle strength, and just overall physical function, which is helpful in any autoimmune disease, but particularly these types of conditions that can affect our mobility. So doing low impact exercises like swimming, yoga, and walking are often the best types of exercises to be doing. And if you are able to do something more intense and, build up some muscle mass, do some weight bearing exercises like Pilates, that's going to be great for you as well. So I hope you found today's episode useful. If you have any questions about scleroderma, about nutrition that may help with scleroderma, or you have any questions about autoimmune disease generally, then feel free to pop over to my Instagram account, which is at the Autoimmunity Nutritionist. I also have my free group, the Autoimmune Forum, where I'm sharing autoimmune insights, lots of delicious, healthy recipes, and we're just there to, ask questions about autoimmune disease, to share information. So I'd love to see you over there. If not, have a fantastic rest of your week, and I'll be in touch soon. Take care. Thank you very much for joining me today on the Autoimmune Reset. I really hope you enjoyed the discussion, and be sure to subscribe to the podcast so that you never miss an episode. And if you liked it, I would hugely appreciate a review on iTunes, as it helps me understand what you like about the podcast and to help share the information with more people. I'm excited to speak to you next time, and remember, you have the power to take the reins on your health. So keep the faith and celebrate the small wins. Until next time.